A virus that was once eliminated in the US is making a comeback. Right now, Texas is facing a growing measles outbreak. If you have an autoimmune disease or are on immunosuppressive medications, this could be especially concerning for you. In this video, I'll break down exactly what measles is, how it spreads, and why it's so dangerous, especially for those with weakened immune systems, and what you can do to protect yourself. Stick around to the end for some crucial tips on staying safe. What exactly is measles? Measles, or rubiola, is a highly contagious viral infection caused by a single-stranded RNA virus from the Paramyxoviridae family. It spreads through airborne droplets when an infected person coughs, sneezes, or even talks. The virus can linger in the air for up to 2 hours, meaning you could walk into a room long after an infected person left and still get sick. 90% of unvaccinated people exposed to measles will contract it. Measles follows a very distinct pattern, starting with mild cold-like symptoms and progressing to a full body rash. Let's break it down. The incubation period. This lasts between 7 and 14 days. At this point, there are no symptoms, but the virus is multiplying in your body. Early symptoms. This occurs between days 1 and 4 and presents with a high fever, often reaching 104 degrees Fahrenheit or higher. A person often experiences a cough, runny nose, red, watery eyes, light sensitivity, and Koplik. These are tiny white spots inside your mouth and is a telltale sign of measles. Stage 3, the rash phase, which occurs between days 3 and 5 of the illness. A red, blotchy rash starts at the hairline and spreads downward to the trunk, arms, and legs. The rash may merge together before fading after 5 to 6 days. At this point, the immune system is fighting, but the damage may already be done. Most people recover from measles, but it's not always a simple case of fever and rash. In some cases, the virus leads to severe and even life-threatening complications, especially for those with weakened immune systems. Common complications include ear infections, called otitis media, and this can lead to severe hearing loss. Severe diarrhea may cause life-threatening dehydration. Pneumonia, which is the most common cause of death from measles. Severe complications include measles encephalitis. This is swelling of the brain that can cause seizures, permanent brain damage, or coma, and occurs in 1 in 1,000 cases. Subacute sclerosing panencephalitis. This is a brain or a fatal brain disorder that appears years later in measles survivors. More common in people with vitamin A deficiency, occurs in 1 to 3 per 1,000 cases, mainly due to pneumonia or encephalitis. Some groups are at higher risk of severe measles complications. If you or a loved one fall into these categories, you need to take extra precaution. High-risk groups include unvaccinated children under 5 and adults over 20. Immune-compromised people, including those on biologics, chemotherapy, or organ transplant. Pregnant women who face a higher risk of premature birth, low birth rate, and miscarriage. Malnourished children, particularly those with vitamin A deficiency. Before the measles vaccine, this virus infected 3 to 4 million people in the United States every year, causing tens of thousands of hospitalizations and hundreds of deaths. But in 1963, that changed. In 1963, the first measles vaccine was introduced. In 1968, the vaccine was improved. It was a live attenuated vaccine. In 1971, the MMR vaccine, so measles, mumps, rubella, was licensed. And in 2000, measles was declared eliminated in the US due to high vaccination rates. The results were staggering. Within decades, measles cases dropped from over 99%. So why are we seeing outbreaks again? Vaccine hesitancy and misinformation have led to lower vaccination rates, especially in certain communities. This has allowed measles to make a comeback, with outbreaks now occurring in unvaccinated pockets of the country. Let's talk numbers. Just how well does the MMR vaccine protect you? 1 dose of the MMR vaccine provides 93% protection against the measles, 88% protection against mumps, 97% protection against rubella. 2 doses of the MMR vaccine provides 97% protection against measles, and in most people, lifelong immunity. This has made a significant impact in the US. Before vaccines, so pre-1963, you would see 3 to 4 million cases per year. After the vaccine was introduced, 99% decline. Nearly all cases or new cases these days occur in unvaccinated individuals. This tells us that the vaccine is extremely effective, but only if people actually get it. Even if you're vaccinated, there's another reason why it's important to keep your community protected: herd immunity. So what is herd immunity? When enough people are vaccinated, the virus can't spread, protecting those who can't be vaccinated because not everyone can be vaccinated. 95% of vaccine coverage is needed to prevent outbreaks. So who needs herd immunity the most? Immune-compromised people who can't receive live vaccines, such as people on biologic medications, those who have cancer, and are undergoing chemotherapy, organ transplant recipients on immunosuppressive medication. Unfortunately, vaccine hesitancy has led to declining vaccination rates, putting these high-risk individuals in serious danger. So what is the recommended MMR vaccine schedule? Let's start with the standard measles vaccination schedule recommended by the CDC. So for children, the routine schedule includes first dose between the ages of 12 to 15 months. This is the earliest opportunity for protection. The second dose is given at age 4 to 6, usually before school entry. Why 2 doses? The first dose provides strong protection, but some children do not develop full immunity. The second dose boosts protection to 97%. For adults born after 1957, at least 1 dose is needed if there is no evidence of immunity. 2 doses are recommended for high-risk groups. So this includes people going to college, healthcare workers, international travelers, and people that are living in outbreak-prone settings. So the key takeaway here is that 2 doses of the MMR vaccine provides optimal training or optimal protection against measles. So the next question is, do you need a booster? If you were vaccinated as a child, do you ever need a booster? If you received both childhood doses, no booster is needed for routine protection. Additional doses may be recommended in certain situations. So international travelers visiting regions with ongoing measles outbreaks, healthcare workers who may have been exposed to measles, and people living in outbreak-affected areas, such as the 2025 Texas outbreak. The key takeaway is that routine boosters are not necessary, but extra doses may be recommended for certain high-risk groups. What if you have a weakened immune system? Can you still get the MMR vaccine? Who should not receive the MMR vaccine? People on immunosuppressive therapy, including biologics, chemotherapy, people receiving high-dose steroids, organ transplant recipients, people infected with HIV with a very low T-cell count. Remember, not everyone with HIV is immunocompromised. The key takeaway here is that immune-compromised individuals depend on community vaccination or herd immunity for protection. Another question I often get is, can you hold your biologic medication to get the MMR vaccine? The good news, in some cases, you can temporarily stop biologic medications to receive the MMR vaccine under strict medical supervision. If you are on a biologic therapy, pausing medication to get vaccinated may be possible, but the timing depends on the specific drug you are taking and also the underlying condition you're being treated for. Before making any decisions, there are 3 important steps to take. Titer testing. You might already be immune. A measles IgG blood test can show you if you still have antibodies from past vaccination or infection. If positive at a sufficiently high level, you may not need the MMR vaccine. Step 2, assess disease risk. Can you safely pause treatment without triggering a disease flare? If stopping your medication is too risky, your doctor may not recommend holding it. Consult a specialist. Work with your rheumatologist as well as an infectious disease expert. They can determine whether holding biologic is safe and when to time the vaccine. Not everyone can safely stop their medication. Individualized medical advice is absolutely essential. You just found out you were exposed to someone with measles. Should you panic? Can you still protect yourself? With measles outbreaks on the rise, knowing what to do immediately after exposure can mean the difference between mild illness and severe complications. Go step by step. What do you do if you were exposed to measles? When to seek emergency care and how to protect yourself during an outbreak. Let's start with the most important question. What should you do if you've been exposed to measles? Step 1, contact your doctor immediately. Call your healthcare provider right away. Do not wait for symptoms to appear. Let them know about your exposure so they can assess the risk and determine next steps. Step 2, post-exposure treatment option. Get the MMR vaccine within 72 hours. If you have not been fully vaccinated, getting the MMR vaccine within 72 hours can help to reduce the severity of measles. If you cannot get the MMR vaccine, you can be provided with immune globulin. So this may be helpful for patients or people that have immunocompromising conditions, medications, infants under the age of 6, pregnant women. The sooner you act, the better your chances of preventing severe illness. When to seek emergency care for healthy people. Measles runs its course within 2 weeks, but some cases become severe, especially in infants, older adults, and immunocompromised individuals. These are the signs that you need to be on the lookout that may need immediate medical attention. Having a really high fever, so something like 104 degrees Fahrenheit. You have difficulty breathing, or you have a very severe cough. If you experience persistent vomiting or diarrhea leading to severe dehydration, or if you develop neurological symptoms like seizures, confusion, or difficulty walking. If you experience any of these symptoms, seek emergency medical care immediately. So what can you do to protect yourself during an outbreak? Even if you haven't been directly exposed, you need to take extra precautions during an outbreak, especially if you are a higher risk person. Wear a mask. Measles spreads through airborne droplets. A properly fitted N95 mask can reduce exposure risk in public places. Avoid crowded spaces like hospitals, airports, schools, and public transportation. These are high-risk areas. If you have to go out, limit contact with unvaccinated individuals and children. And importantly, it's important to encourage vaccination in your community. The best way to stop outbreaks is by ensuring high vaccination rates. Talk to your family, your friends, caregivers about the importance of staying up to date with MMR vaccines. If there's one thing to take away from this entire video, it's that measles is serious, but it also is preventable. If you are on biologics or immunosuppressive, talk to your doctor about measles immunity. Titer testing can help determine if you actually need the vaccine. If you are unprotected, discuss whether pausing medication is an option for you. Make sure your family and caregivers are vaccinated. Protecting those around you reduces your risk of exposure. Herd immunity is your best defense if you cannot get vaccinated yourself. Staying informed and taking proactive steps can make a huge difference in protecting your health. Now I want to hear from you. Have you or a loved one faced challenges with vaccination due to immunosuppressive therapy? What advice did you or did your doctor give you? Share this video with your friends, family, support groups, especially those living with autoimmune diseases. The more people understand these risks, the stronger our community protection will be. And do not forget to subscribe. If you want science-backed health updates on rheumatology and autoimmune conditions, make sure to hit that subscribe button and turn on notifications. Thanks for watching, and stay safe.